6 ways coronavirus is changing the environment. The coronavirus is upending everything from aviation to the economy, and it's also having a big impact on the environment. Some of these are positive, a big drop in CO2 emissions as factories shutter and the economy sputters, while others are negative. Growing piles of possibly infected wastes like tissues and old face masks. Here are 6 ways coronavirus is already having an effect. First, improvements in air quality. A drop in air pollution was first observed by NASA in China's Hubei province, where the coronavirus outbreak began in December. Second, greenhouse gas emissions. Slowing economic activity also drives down emissions, if only temporarily. As countries order the close down of schools, shops, and factories, emissions are expected to fall. The last time carbon emissions fell was during the economic crisis in 2008 and 2009. But as the economy picked up, so did demand for coal and other fossil fuels, especially in China, the world's largest emitter. And now moving forward for the third, mountains of waste. Coffee chain Starbucks decided to stop accepting reusable cups from its customers, only serving drinks in disposable single-use cups that are not yet recyclable in a bid to prevent the spread of the virus. China is drowning under medical waste produced by hospitals, including face masks and single-use tissues. In the city of Wuhan, the volume of medical waste is reported to have quadrupled to more than 200 tons a day. Single-use medical items that have been in contact with infected patients must be burned to prevent further contamination that could occur during recycling. And now fifth, stalled airline emissions. Air traffic has taken a nosedive since the virus spread to Europe. Despite previous projections of growth, 67 million fewer passengers flew in the first 3 months of 2020 compared to the year before. Airline lobby IATA predicts the global industry could lose up to $113 billion this year. This inevitably means a dip in carbon emissions, but that will only last as long as the virus does. And the last but not the least, climate is no longer the crisis.
Jobless migrants return to poor healthcare systems. A day before the Janata Curfew announcement on March 21, 2020, hundreds of thousands rushed to trains and bus stations to head back home, according to ground reports. This never-before countrywide reverse migration increases the risk of the virus spreading, as has been seen in Italy in early March 2020 and China in January 2020. There are upwards of 60 million migrant workers in Mumbai, Kolkata, Hyderabad, Chennai, Bengaluru and Delhi, according to the 2012 Indian census. Some 33% of these migrants hail from Uttar Pradesh, 15% from Bihar and 6% from Rajasthan, followed by Tamil Nadu, Andhra Pradesh and National Capital Territory of Delhi at 5% each, as per Indian Migration Now, a Mumbai-based non-profit. On March 24, 2020, the Indian government invoked the National Disaster Management Act 2005, which put the country under lockdown for 21 days. Subsequent guidelines shut down all commercial and private establishments except for essential services to minimize human-to-human contact. The lockdown also sealed state borders by halting all transport services, air, rail and road. This put the brakes on the livelihoods of millions of workers in the unorganized sectors, including internal migrants, millions of whom were stranded without any source of income. Migrant home states have poor public health infrastructure. It is impressive for workers from Uttar Pradesh working across the country to return home but stay in isolation, the state's health minister said. UP ranked at the bottom among 21 large states in Niti Aayog's Health Index report published in June 2019. UP was followed by Bihar, Odisha, Madhya Pradesh, Uttarakhand and Rajasthan, all major home states for migrants.
Impact of COVID-19. The World Bank estimated the Indian economy to decelerate to 5% in 2020 and projected a sharper deceleration in fiscal 2021 to 2.8% in a baseline scenario. World Bank chief economist for South Asia, Hans Thomas said, India's outlook is not good, and if the domestic lockdown is prolonged, then the economic result can be much worse than what the World Bank has in its baseline range of forecasts. Then it's important to prepare for a rebound, and that means there should be a focus on the temporary job programs, especially at the local levels. Those initiatives should be supported, and it's important to prevent bankruptcies, especially of a small and medium-sized enterprise, to send a response to a question.
Coronavirus lockdown: how to keep 130 million migrant workers afloat during COVID-19 crisis. The government is in the process of reviewing and deciding on the likely courses of actions to be taken afterwards. But here I will focus on the socio-economic upheaval and its implications that have the potential to make or break society and the economy. The worst affected social group during the current lockdown are the laborers, and more particularly migrants who had left their homes for seeking odd jobs at various places, both rural and urban in industries, services, construction, and even in agriculture. End of 21-day lockdown ending in 14th April 2020. The unorganized sector in India accounts for 93% workforce, as per the latest Indian 2020 publication, which gives ministry wise information about various programs. So, in essence, we do not have adequate data on the details of labor and the workforce in the unorganized sector. Migrant laborers were caught unaware when the lockdown was announced and not knowing what to do, and in absence of a safety net made move towards reserve migration to their place of origin, mostly by foot as public transport got closed abruptly.
COVID-19 shall win this together, PM to Trump on HCQ decision. The US is one of the worst affected nations due to COVID-19 pandemic, with more than 14,600 Americans having lost their lives and over 4.3 lakh having tested positive. Trump has been pushing for the use of hydroxychloroquine in treatment of COVID-19 patients. However, Trump warned for retaliation towards India if ban was not lifted. But India agreed to supply HCQs over cause of humanitarian. A sizable chunk of 29 million doses of hydroxychloroquine bought by the United States to calm India manufactures 70% of the world's supply of hydroxychloroquine, according to the Indian Pharmaceutical Alliance Secretary General Sudarshan Jain. The country has a production capacity of 40 tons of hydroxychloroquine every month, implying 20 crore tablets of 200 mg each. And since the drug is also used to autoimmune diseases like rheumatoid arthritis and lupus, manufacturers have good production capacities that can also be ramped up, including leading companies such as Cipla and Wockhardt. The world leaders are appreciating the supply of HCQs to different nations, including USA.
Early steps taken to fight COVID-19 in India. PM to mission aids. Extraordinary times require extraordinary solutions. Prime Minister Narendra Modi said during a video conference on Monday with 130 Indian missions abroad while referring to the 21-day nationwide lockdown owing to the coronavirus outbreak. In a nearly 75 minutes interaction, Modi said India had taken unprecedented and early steps from mid-January to reduce the risk of spreading the coronavirus infection and preventing a large outbreak. However, this was not applied at airports as many foreigners still arrived in India without proper screening. Modi termed the lockdown as an unavoidable step to fight the pandemic, adding it was hugely consequential as the closure of the globalized system has had an extensive and far-reaching impact upon the international transport system, financial markets, and global economy. The Prime Minister also asked the missions to stay alert and identify best practices, innovations, and scientific breakthroughs to deal with COVID-19 and help procure medical equipment for India's fight against the pandemic. He also advised the heads of the missions to suitably publicize the newly established PM Cares Fund to mobilize donations from across the globe. In another tweet, PM Modi appealed to the citizens, kindly contribute to the PM Cares Fund. This fund will also cater to similar distressing situations if they occur in the times ahead.